Giuseppe Brescia already went into some details. So I please ask Agnes to tell us more about Uganda situation and African, in more general context, situation, taking advantage of the different areas, geographical areas, continents here, let's say, represented. Please.
Yeah, thank you very much. As I said earlier, one of the issues that I was involved in monitoring was the borders. And I think this was not just unique to Uganda, but also, Africa and other places, because our borders, we have that colonial legacy of borders where most of them are porous. You find that communities live on both sides of the border. Colonialism divided them apart. And all of a sudden, you're saying the borders are closed. And some families have a living room in one side of the border and, a bedroom on the other side. So, and they share common spaces, the markets where they would buy food and things like that. So there was really chaos. And remember when the border closures were not, it had to happen because, the pandemic, arrived. So you could really see that there were so many, policy gaps, around there. Migration health was not a focus, originally compared to other aspects of transnational organized crimes, for example. Countries have always been more committed to curbing illegal migration, issues of transnational organized crimes. So migration health, even the presence of health workers and interventions at borders was not well institutionalized, and the structures, some of them were lacking. So there was really, chaos in that area. And even the teams who were supposed to respond to that were not well trained on how do you manage, in a situation of a pandemic. So closing a border did not mean that everybody stopped traveling. It meant that people used these porous border points. And it was mixed because, during that panic, because you've closed regular crossings, other people are going to cross, elsewhere. And as the situation continued, as countries or as Uganda, strengthened its emergency teams on health, another issue cropped up. So people forgot about other forms of migration, that among the people traveling, because if you get anybody moving, on an irregular crossing and you take them straight for quarantine, that is 14 days, it meant that there was no screening. Some of those people on the move, some of them were victims of human trafficking, who were abandoned en route or who are returning and fleeing. So they have unique needs. That means you're, apart from just quarantining them and finding out whether they have COVID and all that, they are not protected in that area. Unaccompanied minors, people like that. And you find that even right now, there's so much focus on migration health that countries are ignoring other issues of transnational organized crimes. And the criminals are not, are not sleeping. They are also reorganizing their processes. We have gone online, and much of our processes, so have traffickers. So trafficking, for example, has gone online as well. And so much as we craft, our policies and what in response, we have to have that in mind. And on top of that, even policy development itself, in some countries, there are no policies of migration in itself. So there was no organized where to go to that, okay, we've been hit by this, okay, how do we move forward? And so people were starting from scratch. But another thing I noticed was that the experts of Africa, foreign experts of Africa, were fleeing, they were catching the next flight. And Africa and Ugandans were on our own. But it also showed us one thing, it also brought out the capabilities of African professionals, to take charge of their own, issues. I remember being in the situation room and like, okay, how do we move from here? We started organizing and mapping out, for example, our porous borders, for Uganda, just Ugandans, getting their own solution. Remember, the experts of Africa have left. And so it really, really built our confidence, among the leadership, among their professionals to say, hey, we rely on our professionals to do things on our own, because every other country is relying on perfecting their own systems. And now I see a wave, and increasingly I'm seeing more and more experts of African origin on Africa. And we are really driving this agenda, and it's really bringing out a lot of those things. I remember personally, I started even writing, about Africa, issues on how Africa is dealing with issues of refugees and all that. And I saw the response, to my op-eds and my articles, which was really great. And in that, we are also in the wave now of crafting our own migration, policies, and incorporating issues of migration health, which is good. And also establishing those interagency task forces, because at the beginning, even it also questioned about the regional blocks we are in, because there was no unified way that, as IGAD or as East African community, how do you have a joint response? It wasn't there initially, but now those discussions have started happening. And now we have, people lining up what are our regional responses to that effect, and all that. So how do we put together those early warning systems that, because there was a definitely failure of intelligence, globally about, predicting or finding out that this disease is coming, among us. And the second area, which I talked about earlier, was the issue of labor migration. We also realized that, for example, Uganda, many of the people on the move were really low-skilled workers, because there are restrictive migration policies in many destination countries on taking on, certain professionals. So many of the people who are moving, in Uganda or out of, Africa, were mainly low-skilled. And low-skilled workers were not actually included, in COVID-19 policy responses, because countries, whether in Africa or elsewhere, were more concerned about their citizens. And remember, people were excluded, law migrants are excluded from labor rights and social security issues. Some of them are in irregular status and have multiple employers. Domestic workers are not even recognized as workers in some of these destination countries. They are invisible. And because you are invisible, you're even fearful. Even if you have symptoms of COVID-19, you're fearful to go forward. Because you're fearing that you could be deported, you're fearing incarceration, you're fearing any what of detention. But people forget that if you neglect vulnerable populations or people in irregular status, you are affecting everybody else in the process. So that was very, very critical. And then of course we are talking about issues of refugees, vulnerable populations. Uganda has a very progressive and open policy. You're looking at a country of just 43 million people, and it's the third largest host country in the world. And as for June 2020, we are hosting 1.4 million, refugees. And thankfully, when they closed borders, my president made, that firm decision to open up, because people from the Democratic Republic of Congo were fleeing these militias, and they were abandoned, at the border. So they opened up, and brought them in deserving of protection, and most of them women, and children. And you've heard all these stories about other places where countries were rigid and not bringing in, other people. And of course, when it is meddled and mixed up with the politics, with the news, which is incorrect, what really comes out of that. So moving forward, I'm really, glad that we are having this conversation, that we are putting all this together, and I'm really learning so much with all what your countries are doing. I'm happy that Italy, for example, just looking at the slides, that you're really taking care, of people who are in those regular status and putting those policy decisions that, hey, we are all in it together. And migration more than ever is not just a one-country affair, but of countries of origin, destination, and also transit. So thank you very much.
Thank you, Agnes. Very interesting, and for sure very linked to what Helén will say now, in addition to what she already said, because especially on refugees, the Nordic countries are very concerned. Please, Helén.
Thank you. Yeah, it's to jump from one extremely interesting discussion to another. So bear with me if I. Yeah, it's very. After listening to you, Agnes, it's hard to talk about the Nordic bubble, but I will try my best. So as you already know, I mean, I'm not a researcher, so I have allowed myself to refer to two reports, one from the public agency in Sweden, Delegation Against Segregation, as well as the Danish Institute for Human Rights, I'm sure you're aware of. So talking about segregation in Sweden, the corona crisis can hit harder, not least economically and social, and against already vulnerable groups, as we have already said, and among them migrants, and it can have consequences referring to these reports even in the longer term. And among other things, this means that the school may find it difficult to live up to its mission during a longer time of distance education. That is very, very common here in my region. And it can also be a matter of that many people losing their income from work because they work under special employment conditions or in particularly affected industries such as the service sector. And here we today have many with foreign background working, and it can deepen the inequality that already exists and lead to further segregation in our countries. And this tendency towards a stigmatization of areas with social economic challenge due to the corona is very worrying. I can even notice it just by reading the media, I mean, as a citizen of the region. And society that is segregated is a society that slips apart. And it affects, of course, the feeling of community, security, and trust. And trust, as you know, is very much focused when we talk about Nordic cooperation. And we also can see that we talk about we and them. And that is also not a good sign. Talking about Denmark and the report from the Danish Institute for Human Rights, COVID came also to Denmark, and quickly, however, the virus crawled down on the social ladder and hit hard in the municipalities where many ethnic minorities from non-Western origin live. The report points to several reasons why the COVID particularly affected ethnic minorities. Figures shows that migrants from non-Western countries of origin counts for 18% of the detected corona crisis in Denmark. And at the same time, they make up just 9% of the population. So here I think we have some interesting figures and reasons referring to the report that the ethnic minorities more often live is that they live together in small spaces. This of course increases the risk of infection among the family members because it is difficult, if not impossible, to isolate oneself from the rest of the family if space is tight. Second, a large proportion of ethnic minorities in Denmark work in industries with a lot of citizen contact, which result in a large exposure to infection during a working day. And third, many people may be at risk of getting serious illness due to their often poorer health if they become infected. And in addition, we do of course have the language barrier, access to information on infection risks and so on and so forth. But many good efforts are being made for workers and companies by the authorities, as well as by the civil society and the private sector. And I can give you a lot of good examples, but at the same time say that the society is need to do more, and politics need to follow the footsteps of the corona crisis in order to reduce the negative consequences for inequality, as the starting point may change after the corona pandemic. In the current situation, it is important that the civil society, municipality, authorities, business coordinate their efforts even more, so that we, with the resources we have, can work against segregation. The second subject or issue I wanted to bring up was migration as such, and I can just tell you that all Nordic countries have produced target information about new coronavirus to new arrivals. The challenge is to reach out with the information, of course, and in several Nordic municipalities, telephone lines have been opened with the way you can have answer to general questions in your own language, a number of languages, and then I mean, to get more information on how to stop to spread the virus and to protect yourself. Referring to Sweden and to say, and so to say, talk about the break when it comes to the resettlement program. The decision is followed up on an ongoing basis and will be considered when expert authorities access up on an ongoing, access the risk of the virus spreading in the world has decreased, and there is an opportunity to restart the program. Although when it comes to urgent matters with special circumstances, there can be, after checking the state of health and after agreement with the receiving municipality in Sweden, it can be possible also now. Few sentences maybe from me when it comes to circular economy or labor migration in our region. I would like to use Lithuania as an example. As you know, and I think Ibrahim knows even more, we have a big diaspora in UK, but also in Norway and in Iceland. Living there, but we are also from Lithuania, but we also have a big group commuting in the region, going back and forth. And this has, of course, due to lockdowns, been stopped. So we can see the increase of unemployment. But also, maybe, I have no evidence, but maybe in the long time also increase of return migration to Lithuania. They are a little bit small signals for that. Last but not least, the children and youth and close the schools, referring to representatives of BRIS, it's the telephone line in Sweden, and the UNICEF and Save the Children in Sweden. School is important for children to not only for their education, but also in the base on a social context. So for many children, the school is the heaven, with safe routines, peers, adults who meet the children every day, and also for the free meal. And now when this kind of is maybe back on track in some countries, but not full swing. We could see that the most vulnerable groups, such as unaccompanied minors, are effective. Also, children in newly arrived families and other groups, as well as undocumented migrants, are more or having difficulties now when they don't have any school to go to. I think also here we could say that many things has been done, but it is for sure not enough, and we need to do more to enable social services, to provide support to the families. It can go when it's maybe food, but it's also more help on technical, digital solutions to be part of this, so to say, distance learning program, and not have any problems in the field of education for the future, because it looks like it will stay. And then I just would like, I have 1 minute left, to you researchers, tell me more about what do you see in media? I can just give you an example from Norway when we had an outbreak among students, and another one among Muslim community. And the media coverage was totally different from when they covered the students who got as many infected as the migrants. So do you see any tendency on how the media cover COVID in the field of, or for migrants, maybe I could say? Thank you.
Thank you, Helén. It's been very interesting to have a picture of the measures that has been adopted to contrast the pandemic. I would like now to ask Giuseppe Brescia to intervene, because the position of Italy, as we know, is somewhere in the middle. One side we heard Agnes about Africa, now Helén with Northern Europe, and Italy also in regard of asylum seekers is right in the middle. Italy was right in the middle at the beginning of the pandemic as well, just after China. So please, Giuseppe Brescia, the floor is yours.
Yeah, now. Before to start my second part, I want to thank all of you, and especially Agnes, because I totally agree with her when she said that the immigrant phenomenon is a global matter. And I always try to say this in Italy, but as you can imagine, as a politician, it's very hard to let people follow this way to see the phenomenon. By the way, I start with my second part. COVID crisis has stressed an ancient problem, the missing traceability of undocumented migrants workers. This phenomenon has always serious consequences in our society in many aspects, both in normal times and during a pandemic. There are obviously economic and physical issues, since irregular immigrants do not pay taxes and they are invisible for the state. They contribute to underground economies and undermine competition. There are also security reasons. Undocumented migrants are more exposed to exploitation and involvement in criminal networks. Moreover, their work conditions are quite far from an acceptable level. During the pandemic peak, a further factor suddenly arose in the public debate. We have learned in these months that prevention and tracing are the most effective methods to fight the virus. These issues have increasingly been present in the public debate, also thanks to the commitment of civil society organizations. Actually, Italian government has been already working since January on a regularization draft. COVID emergency has only accelerated this decision-making progress. The graphs shows on the slide number 11 shows the number of estimated irregular migrants across the last 30 years in Italy. You can see different peaks and drops, mainly related to different regularization or EU enlargement process. The last drop date was 2012, the year of the last regularization. In the last 8 years, migration flows towards Italy have grown. The only way to legally entry in Italy is represented by the decrease on flows that yearly sets a certain number of person, 30,000, and it's clear that this system is not working. Moreover, 2 years ago, the humanitarian protection has been abolished. This form of protection, apparently residual, covered almost the 30% of the cases. The effect of the abolition has been negative. It has created new irregulars, at least 50,000. For this reason, we are going to modify the law in this aspect. I quickly list the requirements for regulation approved in the relaunched decree by the government. The decree became law in May, and the Article 103 defined the criteria of the procedure, open for 10 weeks. Regularization concerns sectors such as agriculture, animal farming, fishing, assistance to the person suffering from disease, domestic work. And I have personally asked for the measure since 2018, and I underline the importance to give the opportunity to other sectors such as tourism and constructions. Two channels of regularization were provided. The first was for employers that sign a new employment contract or declare one irregularity established contract for foreigner citizens present on the national territory before 8th March 2020, and the second for foreigners with a residence permit expired after 31st October 2019. Then the slide number 13. In these last slides, I just want to briefly mention the outcomes of the regularization. More than 207,000 applications were sent in 10 weeks. 85% of them come from domestic workers. This chart show the region with the highest numbers of applications. Obviously, the applications in agriculture sector in higher in the southern part of Italy, but in general it emerged that the phenomenon of irregular has been widespread throughout the country. Slide number 14. I have to say that there has been a lot of political criticism about the measure. Right-wing parties have attacked the regularization with the usual slogan, foreigners steal our job. But actually, Italian employers and families have taken advantage of this procedure. More than 90% of regularizers in agriculture and almost 80% for domestic workers were Italians. The last two slides. This slide, the 15, allows me to share with you a personal concern. This regularization has been a success. We realize our initial goals according to the design of the policy. However, I'm afraid that we did not reach all the irregulars in Italy. The nationalities of regularized people are useful indicator. People from Ukraine and Georgia do not arrive in Italy by boat. There are different kinds of immigration in the irregular migration as well. So we have to we discovered just a part. The last slide explains why this regularization has been a success. Actually, 8 years represent a huge lapse of time, and migrations have dramatically increased in these years. So the numbers could be influenced by this fact. Moreover, a further regularization was already promoted in 2009. However, some criteria were strict, and the procedure was open for just 1 month. The regularization procedure approved in 2020 has been easier and less expensive for employers, even if it was open to limited sectors. We have reached 1/3 of the irregular migrants with clear social benefits. I'm aware that we have to face a further challenge. This not depends from COVID-19. We have to open effective legal channel to come in Europe and in Italy. In Italy, we have to reform the decree of flows, elaborated more than 20 years ago. Quotas and application form abroad do not satisfy the labor market demands, and this regularization is a proof of it. Thank you.
Thank you, Giuseppe. I would like now to invite Jeffrey to give us his considerations about the effect of the pandemic on the migration policies, with a special look on the other continent, or even in the whole world. So please, Jeffrey. I can't see you.
Yes. Can you guys see me? I don't know what I think the screen needs to change. There you go. All right. Well, thank you. Thanks again for doing this and inviting me. I can't comment in great detail on the differences in the experiences between the U.S. and Europe. I think it's quite clear that the policies of the Trump administration were quite created a fairly high bar that immigrants had to cross before crossing physically, right? It was, and that's only increased with the pandemic. It's increased in terms of the rhetoric, with administration officials describing COVID-19 as somehow or another a foreign invader, but also in terms of using healthcare as basically weaponizing healthcare in addressing access to resources for immigrants. And this has been something that's continued to the present. And in fact, you could almost argue it's being exported as the policies of the US government include things like deportations and removals that are returning people who may be at risk or suffering from things like COVID-19 to their sending homes. And that's a fairly major sort of problem. So one of the things, though, that I think doesn't necessarily reveal itself in these discussions of the outcomes are the effects of COVID that are maybe unanticipated. And perhaps the best example of this is the work that we've been doing in Mexico with migrants from rural parts of the southern portion of the state. These tend to be largely indigenous movers who are leaving rural poverty and places of fairly marginal existences where they already face limited educational resources, limited healthcare resources, limited opportunities for work, where farming has basically collapsed under the pressures of climate change. And in their migrations, for many different reasons, but one of the criticals, of course, supporting their families that they've left. And if you look at estimates and predictions that were coming out in March and April, for example, the World Bank had projected a 20% decline in remittances. And that's something that may still occur. I mean, we're still in the very early parts of this, of the pandemic. But what we see in places like Oaxaca, Mexico, where I work, which is again in the south, one of Mexico's 3 poorest states, we see that remittance rates have actually increased, not decreased, and they've increased substantially. So that the country, or so that the countryside is being supported in ways that it really wasn't even before the pandemic. And these remittances have become perhaps the most important lifeline to maintain rural villages and rural communities. One of the things that we're not talking about is the pressure that's putting on not just the movers, but also the non-movers, the expectations of people who are living in communities that have been largely isolated or self-isolating in response to the challenges of COVID because there is no health care available. But also the movers who are in places like Southern California, Texas, and Arizona, where the pandemic has really hit very hard in the last few months, and struggling to return money while managing their own health care, managing very limited access to care here. And so that's kind of one of the reasons why I divided the idea of the pandemic and the idea of COVID-19 into what we can think of as direct effects and indirect effects, right? Looking specifically at the infection rates, one of the things that's very clear coming out of research in our research in southern Mexico is that there's been a very limited sort of physical impact of the virus. We don't see, there's nationwide, Mexico is one of the countries that has been perhaps hardest hit by infections and by COVID-19 and by deaths. In Oaxaca, the state itself represents no more than 2% of that total, which is very low. And in the regions of the state where we're working, which is with indigenous populations and looking at migration, we find that about a little more than a third of the communities that we've been working in show no signs of infection. Okay, so these are places where, at least officially, there's no acknowledgement. Now, there may be, one of the questions that we have is whether or not people can actually tell, and there's some debate over how people are defining the infection, but it doesn't seem to be showing up. So for us, one of the direct impacts of COVID is not really helping us understand how this is affecting migration, right? So we look to the indirect effects, and we can talk about things like self-isolation, which is a strategy for containment and for limiting the virus, but it's also driven by social inequalities and the fact that these communities basically, if you look across the state, 80% of the communities have no access to any kind of health care beyond a very limited public health office. The challenges, the cultural challenges around, say, the mistrust of doctors and so on, only complicates those sorts of issues. So looking at these indirect sorts of outcomes, another which is absolutely critical and has been mentioned is the issue of language use and access to messaging. And these are communities where not everyone is a native Spanish speaker, where bilingualism tends to be the rule, but where you have still monolingual native language speakers, and the translations that are made are typically heavy-handed and quite limited and tend to follow what has been called by one of our informants a Yahoo translation model, which is word for word and doesn't really capture much of anything. That's complicated by the fact that a majority of these communities have no access to those messages. So even when the messages is poorly put together, people aren't necessarily being able to access it because the internet is so limited outside of the capital city. Okay. The third problem is things like the message when it says wash your hands, practice social distance. These are communities where about 30% of the homes will have access to running water, and even less will have access to clean water. So this becomes an issue. How do you actually encourage people to do the kinds of, or to participate in the kinds of practices that you see as making a difference? You can't get the message out. The message isn't in the right language or in the right format. And then the very things that you're asking people to do are things that they can't necessarily do. So all these things combined, the direct and indirect sorts of outcomes of COVID, as critical issues for us to study. I'll just end by saying the experiences of these rural communities show us that there are ways in which people can adapt and answer. And this self-isolation that we see in rural Oaxaca is one example of this. But at the same time, it's in a sense a reaction that's driven not just by local knowledge, but by the knowledge that the state will not engage. Okay, so the same sort of problem that we see when the United States says you can't stay, we're going to deport you, or limits access to medical care. Same sort of challenges in these rural places as well. So I'll leave it at that. Thank you.
Thank you very much, Jeffrey. Now the last words of this second round to Professor Sirkeci, who could maybe accept the invitation from Helén about what the media, how the media presented the pandemic linked to migration, and also to give us some of his ideas about changes in policy making.
Thank you, Michela. Thank you, Jeff, and Mr. Brescia, and Agnes and Helén. I'm representing or describing how media reacted to it is pretty much, work in progress, I would say. But I would like to, look into the questions, two questions raised in the Q&A section. Our colleagues are asking about whether EU will adopt more restrictive migration policies in the future. And another question is more specific to Italy, but it is raising the issue of access to healthcare during pandemic and after. So I think Jeff already made quite a lot of innings in this regard. It is, there are hierarchies we know in terms of discrimination, in terms of disadvantages, and in terms of deprivation in line with those. So we have seen similar trends in the UK and in other countries, I believe. Some places obviously hit worse than others. In the UK, what we have seen is, I think, probably you followed it from media as well. We have seen first a significant difference between migrant minorities, ethnic minority communities, and the rest of the country in terms of high level of infected people, case numbers, and also death toll among especially Black and Asian minorities were very high. So these are all reflecting, in one sense, differences. Differences of people. Regarding their backgrounds, regarding their socioeconomic, circumstances, and so on. But also, these are, long-term, patterns we know exist in terms of labor market, in terms of access to healthcare, and COVID obviously didn't help, help in any way or shape or form. So one question is obviously, during COVID, big question was irregular migrants. In any country, in any immigration country, we kind of estimate about 10 to 20% irregulars to be present. These are probably, pretty much, modest figures. It could be higher or lower, we don't know. But that is indicating a large number of people, a large volume of population left outside of any measures taken in any country, because nobody is targeting with tests or injections or vaccines or anything to those irregular populations. And obviously the fear is great due to COVID and health risks as well as other risks. Economy in the UK shrunk about 24% in 2020. So nobody is expecting it to bounce back soon, and we will see more adverse effects following in the coming months and perhaps years. So it is not a not a unique case anyway. Many other countries are in the same boat. We are seeing economic recession is coming in around the world in big numbers, big terms. So we will see this affecting immigrants and immigration negatively. And further restrictions in terms of policy, I'm sure there will be, because prior to COVID, we already had a good decade of anti-immigration sentiment growing in Europe and North America and other immigration countries. And COVID is just playing into those hands. There will be further strengthening of anti-immigration parties and politics, and we will see these will be reflected in new policies made in those countries. So there's no two way about it. In this regard, we will see much tighter immigration regimes, and probably you have seen it in other countries as well. In the UK, you had these safe bubbles, safe corridors. Certain countries can travel back and forth between UK and those countries, and people can travel. So this will be shaping the new corridors or established corridors of migration. Will be forced to fit into these new regimes of international human mobility. So media is only one side of the story, but perhaps I can draw a line by quoting maybe two interesting angles, because as I said earlier, prior to the COVID pandemic, there was already a very toxic language dominant in both politics and media in the UK and elsewhere. But in the UK, what we have seen also, because the health service and many other public services are pretty much dependent on migrant workers. So a significant portion of nurses are immigrants in the UK. There are many Ugandan nurses in London, I know, and same applies to doctors, same applies to other healthcare services. Domestic care is pretty much dependent on foreign workers, migrant workers. So, I mean, this was in a way a positive light, because during the pandemic, especially in the early weeks and months, it was made clear that, you know, these countries like UK are in need of immigrant workers, particularly in these key sectors, and that was a positive thing. But again, you know, this is one side of the story, and it is the early side of the story. Next, we will see a big change, big shift towards the other, you know, other direction. That means anti-immigration will get stronger, because when the economy goes bad, you know, does badly, we know there will be pressures on politicians, and I mean, migrants as usual will be, you know, usual suspects, you know, scapegoats in this game. And we will see more and more headlines appearing and, you know, blaming migrants, you know, taking jobs, etc. And politicians, I mean, Mr. Brescia, I'm sure, is aware and knows it better, have to bow, because, I mean, a typical politician is always occupied with the idea of next election. So in any given country, you have elections in every other year. I mean, so, and you have to pick the headline, and you have to follow what is popular, what is populist to an extent. Even if you say you are not a populist politician, you have to, you know, speak the language your voters, your electorate wants to hear. So we will see, unfortunately, you know, it is very pessimistic view from me, but we will see a worsening, you know, environment, political climate for immigrants in most countries. Thank you very much.
Thank you, Ibrahim. Many ideas, many suggestions from your interventions. So I open the space for questions. Please put your hand up.
Michela, there is the live event Q&A section. I can see there are quite a few questions there. I quoted some of them. The latest one is asking the panel, do you expect the flow of migration from developing countries to developed ones to actually decrease instead of increase? So this is something we can discuss.
Yeah. So Jeffrey, maybe could answer, or Ibrahim?
Yeah, I mean, I think Jeff left a message for us. He has to leave the session. But yeah, I mean, you know, I already said this. I mean, when the political climate is so negative, which is already turning away, I expect, you know, that will discourage quite a few migrants from developing countries. So the answer to that question is yes, I expect the flow of migration to decrease. Another reason for that is we will see more restrictive policies and more restrictive measures. And also, unfortunately, there will be more anti-immigration sentiment among, you know, majorities in those countries too. So I expect a negative move in this regard.
Helén?
I just wanted to maybe highlight more on a practical note that during summer and in the autumn, of course, we had a huge need of seasonal workers, and there we saw a dramatic decrease due to logistical reasons, but also due to the lockdown. So we didn't offer the possibility for the ones to come to our region and work, and that was purely COVID and the protection and the lockdown that was on the priority of the country.
Maybe Giuseppe Brescia now, also asking him to say something about what the Italian government is thinking to do, how is thinking to intervene about the arrivals, illegal arrivals from the sea, but not just from the sea, because we have Balkan route, etc. Please.
Yes, I have to say that I agree with the perspective that says that migrants from the developing countries will increase. For sure will increase, but especially in this period of with the pandemic, we have to manage the phenomenon. It's something that in the last years in Italy we failed. So now we have to try to manage the phenomenon, and we know that we are, as other country in Europe, in need of migrant workers. So we have to try to match our needs with their needs, and we have to improve the corridors and the legal way to enter in Italy and in Europe, because as I was saying before, it's not only an Italian matter, it's a global matter first, and then it's a Europe matter. So it's Europe that has to answer with the good policy and the unique policy of the Union. So all the states in Europe, all the European countries has to, they have to start to think different about this topic, because every time German do one thing, France do one thing, Italy another thing, and then not to talk about Hungary or Latvia or all this country, Poland, for example. We have to be the EU. So we have to build the EU process much better than we do for now.
Agnes, yes, it would be very useful to have your sentiment about the possibility of decreasing or increasing movements from Africa, for instance, and how is the perception of African citizens about the destination countries nowadays?
Yeah, thank you very much. And of course, I agree with the earlier speakers. But I just want to point out that many times they're talking about migration from Africa to Europe or other countries. But speaking of the media, what we don't see in the media is that Africans actually move more within Africa than out of Africa. That is usually distorted because they show more boards subsiding and all that. No one is looking at that. Africans move a lot more within Africa. And restrictive migration policies make it even tighter, for them even to go, abroad. And also what is usually not documented more often is the increase of people from developed countries coming to Africa, especially, in the development, jobs. And now that people are losing many jobs, in those countries, that is usually not documented. And much as, people in Europe, also talk about, oh, immigrants have taken the jobs. In Africa, it's actually developed, high skilled. They come and take up, that's why I told you earlier that, when the consultants or experts of Africa, foreign experts in Africa left, the African experts now are more visible and they're doing things, it's amazing what they've been able to do even when they've left. But you know, that angle, even in the media, you know, to pull it out, you know, is usually neglected. But I'm also going to see more of south to south, you know, migration, mainly because we are into regional communities. I know that I'm a member, for example, I represent Uganda as a negotiator on the free movement of persons regime under IGAD. These are 8 member countries, you know, in Africa. Like just as you see East Africa Common Market Protocol, ECOWAS, and all that. So the intent is to really make migration easier within Africa and among Africans. And you know, rightfully said, we are going to see a lot of more sentiments in the media about Africans or people from developing countries coming to take away the jobs when the economy is bad, just like Ibrahim said, you know, it forces, you know, all the politics and everything in there. But I'm also, you know, optimistic that, you know, if we engage the media more, if we continue talking more and really highlighting how migration has really supported many of our economies, some economies who are really struggling with aging populations, and, you know, those gaps. And increasingly, I wish people could recognize that domestic work, for example, is work, you know, and really not give leeway, you know, for people to get into irregular, you know, situations. It's just like how societies look at women, because what women do at home as household work is not seen as work. It's actually a general global problem, the issue of not recognizing domestic work, for example, and others in the informal sector. But I'm optimistic that maybe this COVID, because it affected all of us, that we are also going to look into ourselves and be more accommodating, you know, of others as we sort out this issue collectively. Thank you.